Hi, my name is Bevan Amesqua, and I will be giving a presentation on the genetic disorder known as cystic fibrosis. So I first just want to talk a little bit about the history of cystic fibrosis. Pathologist Dorothy Anderson in 1938 first named it cystic fibrosis of the pancreas after performing several autopsies on malnourished children. There has been some other documented cases from the Middle Ages with notes of pancreas failure and also salty skin. And Dr. Anderson and her team were actually the first to develop tests that actually diagnosed cystic fibrosis. And I just also want to talk a little bit about the prevalence of cystic fibrosis. It occurs in about 1 in every 2,500 to 3,500 white newborns. It's the most common genetic disorder amongst white people, and 20 million Americans are considered carriers of cystic fibrosis. However, it's much less common in other ethnicities. Only about 1 in every 17,000 African American newborns have cystic fibrosis, and about 1 in every 31,000 Asian newborns have cystic fibrosis. So I want to talk just about kind of what cystic fibrosis is. So it's a genetic mutation that causes what is usually kind of a watery and thin mucus to be really sticky and thick. And this sticky and thick mucus causes damage to your lungs and your digestive organs. Usually the mucus just kind of lines your organs and everything, but with the mutation and the sticky and thick mucus, it can cause your airways to clog, and there can be scar tissue and cysts build up in your lungs as well. A lot of people with cystic fibrosis have to be on breathing treatments, and they have to be on breathing treatments for most of their lives, and sometimes even have to end up getting a lung transplant. Aside from effects on your lungs, you can also cause blockages of your intestines. This is one of the most telltale signs in those newborns that are diagnosed with cystic fibrosis. A lot of them have blockages in their intestines a few days after birth, and it really usually leads to a diagnosis. It can also damage the pancreas, and overall it just leads to malnutrition, poor growth, and weight loss in people with cystic fibrosis. Of course, there can be more serious health issues as well, more susceptible to respiratory illnesses, and just other illnesses in general. So the molecular cause of cystic fibrosis is a mutation in the CFTR gene. That's the cystic fibrosis transmembrane conductance regulator. This mutation alters the chloride channels, which, as I mentioned before, leads to the sticky and thick mucus. It also kind of gives a salty taste to your skin, which is one of the diagnostic tests for cystic fibrosis that I will discuss a little bit later. And the CFTR gene is found on human chromosome number 7. So the mode of inheritance for cystic fibrosis is that it is an autosomal recessive disorder, so it's not sex-linked, and both parents must be carriers in order for the child to have the disorder. If both parents are carriers, then their children will have a 25% chance of having cystic fibrosis. If one parent is a carrier and one parent has cystic fibrosis, that percentage goes up to 50%. Their children will have a 50% chance of having the disorder. It is important to note that carriers do not have symptoms. There is no phenotypical or outward appearance of being a cystic fibrosis carrier, so most people have no idea that they're carriers until they have a child that's diagnosed with cystic fibrosis. And I found this helpful image from the What is CF website. And on the leftmost side, you can see that this is a scenario where both parents are carriers. So again, they both have one mutated CFTR gene. And you can see that they have one child that has CF, there's 2 children that are carriers, and one child that's not a carrier and does not have CF, so it's not affected at all. And on the other side, there's 2 parents, one of them is a carrier and one of them actually has cystic fibrosis. And as you can see there's out of the 4 children, 2 of them have CF and the other 2 are carriers. So there's no unaffected children. And I also made a pedigree for one of our projects in this course, so I wanted to briefly go over that. Anyone with a green square in the pedigree is considered affected by CF. And you can see at the top, there's Ben and Bevan, and they have 4 children. One of their children are affected with CF, so they are both considered carriers. You can see then that one of their children, Alyssa, she was a carrier. She received 1 mutated gene from them and from her parents, and married another carrier, Andrew. They also had 4 children, and one of their children ended up having cystic fibrosis and one of their grandchildren. So this is just a good visual to kind of further go into the mode of inheritance of a recessive disorder. So then I just want to talk a little bit about what a normal CFTR gene is like. So as I mentioned before, the CFTR gene helps code for that conductance regular, and it produces your mucus, sweat, saliva, tears, and your digestive enzymes. Again, the mucus in a normal person without a mutation is very watery, and it's not sticky at all, and it can help the chloride move in and out of your cells, and it also allows for water movement in your tissues, and more so, and the mucus will protect and line your digestive system and your respiratory system as well. So the mutations that actually cause CF are considered protein production mutations, specifically splice mutations and deletion mutations. A splice mutation alters how a cell reads the RNA instructions, so it will either remove more than it should, or it'll leave more in than what it is intended to, which kind of results in a mutated protein, and it's no longer, a normal CFTR protein. The most common mutation that we see with cystic fibrosis patients is the F508 deletion, and it removes a single amino acid from the protein, which totally alters the shape of the protein, and that protein ends up getting disposed of. So there are some genetic tests available for cystic fibrosis. We have what's considered carrier testing, and it's tested on either a blood sample or DNA from inside your mouth. A positive test means that you are a carrier and you have that 1 mutation for the CFTR gene. And it's typically performed either prior to pregnancy or during pregnancy. If you have a family history of cystic fibrosis, you might get tested prior to conceiving, but most people usually, actually a lot of people don't get carrier testing and don't find out they're carriers until they have children or a child diagnosed with cystic fibrosis, but it is available for anybody who is pregnant or is contemplating getting pregnant. And I found Integrated Genetics, which is a LabCorp specialty testing group, and it offers some carrier testing, and it can cost up to $3,000 or more. Some other testing in regards to cystic fibrosis is newborn screening. This is mandatory in all 50 states, and it's tested on blood droplets on a little index card from the newborn's heel, and they test it for the immunoreactive trypsinogen, and that IRT is usually really high for people with cystic fibrosis, so it's a good indicator that there's a possibility of cystic fibrosis in that newborn. And then a high IRT mixed with maybe like an intestinal blockage might lead to a sweat test, which is considered a diagnostic test for cystic fibrosis. Since they do have more chloride in their sweat, this is considered a confirmatory test for cystic fibrosis. And early diagnosis is very important for cystic fibrosis. It helps prevent malnutrition, lung disease, and in some cases even death. And I also just included some slides on some references that I found all of this information on throughout the semester. And thank you so much for watching my presentation.